Leading today's discussion once again is Dr. Paras Vicaria. Paras, we'll let him introduce himself. Paras, go ahead.
Thank you, Sean. Hey guys, my name is Paras. I'm a dermatology resident at UT Southwestern here in Dallas, Texas. I originally graduated from pharmacy school in Missouri and then went back home to Michigan to finish medical school. I also work as an RX coach, so I work one-on-one with students to help prepare them for the USMLE Step 1 and Step 2 CK as well, and I'm happy to help lead tonight's session.
I know I mentioned RX coach earlier, and we'll talk more about it later, but what I do want you to know right now is that the process and methodology that we will use as we tackle these 4 questions this evening will be the same process that we use with RX coach. So without any further ado, let's go ahead and get into our first question of the evening on the topic of biochemistry. As you can see, the answer choices are covered up. That is by design. We do that because we don't want answer choices to guide or dictate your thought process, and we don't want you to see an answer choice that you may be unfamiliar with that may cause you to panic as you're trying to answer the question. So I've gone ahead and removed those answer choices here for you, and we will begin with the lead-in. Which of the following is most likely present in this patient? Which of the following is most likely present in this patient? Now that we've read the lead-in, I'll give you a few moments here to respond in the question box and let us know how many steps you believe this question will require. An example of a 1-step question is when they ask you for the diagnosis. An example of a 2-step question could be where you're asked for the treatment for a diagnosis. And an example of a 3-step question could be where you're asked for the mechanism of action for a treatment for a diagnosis. So we'll wait a few minutes here, or a few moments rather, for you to respond in the question box, and then we will begin by reading the vignette. All right, so the responses are coming in, so let's go ahead and read that vignette. A 15-year-old girl is brought to the clinic because she has not yet started menstruating. She feels embarrassed because, although she considers herself a girl, classmates have commented that she has masculine-appearing muscles. As an infant, she had clitoromegaly. Further evaluation shows that her internal genital tract is mostly male, with epididymis, vas differentia, seminal vesicles, and ejaculatory ducts that empty into a blind ending vagina. The serum electrolytes are normal. Which of the following is most likely present in this patient? I'll give all of you a moment here to start thinking about the important clues in the vignette and lead-in. Let's hand it off to Paras.
Thank you, Sean. So what we're going to do is we're going to go ahead and highlight what we think are the important clues in this vignette and the lead-in, okay? So starting off with the vignette. So, usually they're going to give you demographics, and in this case, we have a 15-year-old girl. Always important to make note of that because that's really going to clue you into what's going on in the question, what kind of things you should be thinking about, okay? As you can see here, they're kind of getting at some issues about sexual organs, both external and internal. So it's going to be important to highlight those clues that are going to lead you to a diagnosis. So, they tell us she hasn't started menstruating. They tell us about her masculine appearing muscles, about what her internal genitalia and external genitalia look like. All important to make note of, okay? And then also it's important to make note of any lab values they give in the situation. And in this case, they tell you that the electrolytes are normal, okay? So then they're asking what's most likely present in this patient. So I think there's maybe a couple steps going on here that we need to figure out. Probably a 2-step question. 1, what is the condition? What is diagnosis? And then based off that, what would be present from the answer choices? So I think a 2-step question here. So let's go ahead and take a look at those answer choices. And as you can see here, we have 5 answer choices, okay? Some nice, tough answer choices. So what we're going to do is we're actually going to go ahead and read them one by one, but what we're going to do is we're going to start at the bottom and we're going to work our way up to the top, okay? A lot of times we'll see students who start at the top and work their way down, and what'll happen is, they'll see something they like, they'll select it, and then they may get the question wrong. So doing it this way actually prevents you from biasing yourself and make sure you get through all the choices. So let's go ahead and do that now. Answer choice E, XXY genotype. D, hyperkalemia. C, elevated testosterone to dihydrotestosterone ratio. B, cellular resistance to testosterone. And A, 17-alpha hydroxylase deficiency. So we're going to go ahead and open up the poll. Go ahead and select what you think is most likely present in this patient, and we'll talk about it in just a few seconds.
Excellent, thank you, Paros. So as you can see, the poll is open. We'll wait until about 2/3 of you have responded before moving on. As I mentioned earlier, we do have our raffle and special offer, so make sure you stick around until the end. You might be tonight's lucky winner. And because our attendance is a little low, your odds are higher of winning that prize. I see the responses coming in. We'll give all of you a few more moments here. Remember that on test day, there is no penalty for guessing. So even if you're unsure about the answer tonight, don't worry, take your best guess, and then we will review the incorrect and correct answers here in just a moment. All right, well, let's take a look and see what you selected. Looks like 35% of you selected answer choice E, elevated testosterone to dihydrotestosterone ratio. And the second and third place were pretty close, with 25% of you selecting B, cellular resistance to testosterone, and 24% of you selecting 17-alpha hydroxylase deficiency. So let's take a look and see what the correct answer is. And the correct answer is indeed C, and 35% of you got it right. So well done. This was a challenging question. Let me hand it to Paros so you can explain these answers to us. Paros.
Thank you, Sean. Yes, nice job, guys. This is definitely a tough question. So let's take a look at that vignette again, okay? So we know that this patient has male internal genitalia, okay? They said that the internal genital tract is mostly male, okay? We also know that there is virilized external genitalia, because they said that she has, as an infant, she had clitoromegaly, okay? We also know that this patient has other features of male development, specifically the masculine appearing muscles around puberty, okay? So it's fair to say that this patient has a genotype of XY, okay? And characteristically, the condition here would be 5-alpha reductase deficiency, okay? On the next slide, Sean has gone ahead and pulled up a couple key tables from first aid, okay? And you can see there, first we'll take a look at that table at the bottom that talks about 5-alpha reductase deficiency, okay? So it's limited to genetic males, and you cannot convert testosterone to dihydrotestosterone, okay? So what does that mean? That means you have ambiguous genitalia until puberty. At puberty, the rise in testosterone does cause masculinization of the external genitalia, okay? So we know that you won't have DHT and you will have testosterone, so that testosterone to DHT ratio is going to be high. And as you can also see there, the internal genitalia are normal, okay? So as Sean is highlighting, you can see there that our patient has male internal genitalia and ambiguous external genitalia until puberty, when that testosterone increases, okay? Now you can see there on that diagram on the left side in the blue shaded area that DHT leads to the development of external male genitalia, so the penis, the scrotum, and the prostate. So because this patient didn't have DHT, this is probably why at infancy it was thought to be a clitoris and thus clitoromegaly, okay? However, the patient is XY. So hopefully you can also see why, and then you know, why the patient had the signs and symptoms they did. Let's take a look back, go back to our vignette. It also makes sense when they say that she hasn't started menstruating. Well, that's because she's XY, okay? So Hopefully that makes sense. Let's talk about the other answer choices, why those would be incorrect. Answer choice E, XXY patients, that's getting at Klinefelter syndrome. And these patients, although they do have infertility and they can have small testes, they do still appear male. Okay, so not what's going on here. Answer choice D, hyperkalemia. This is something you could get with maybe 21 alpha hydroxylase deficiency, okay, where you'll have increased androgens. However, it's safe to cross this one off because they said the serum electrolytes are normal. So hyperkalemia would likely not be present, okay? Answer choice B, cellular resistance to testosterone. I believe this was the second most highly selected answer and probably the main other diagnosis on the differential here, and that's androgen insensitivity syndrome, okay? So you have a defect in the gene that codes for the androgen receptor, okay? These patients are XY, but they're phenotypically female, okay? They have bilateral testes that are undescended or located higher up. Patients with AIS or androgen insensitivity syndrome show no evidence of virilization because there's a receptor issue in the androgen receptor, so it's lack of any androgen effects. This patient does have virilization, so also not the best answer choice here as well. And then lastly, answer choice A, 17 alpha hydroxylase deficiency. This is another cause of congenital adrenal hyperplasia, and you can also see gonadal failure, or failure of the gonads to develop. However, you do have increased mineralocorticoids, so you would see hypokalemia, which is not what we're seeing here, so this is likely not the best answer. Hopefully you guys are able to pick up on why this is 5-alpha reductase inhibitor, or a 5-alpha reductase deficiency. These are nice, tough questions that they like to ask on step one. So great job with this question.
Excellent. Thank you, Paros. Great job, everyone. That was a challenging question. Let's go ahead and move on to our second question of the evening on the topic of biochemistry. At which of the labeled sites on the image is the mutation most likely located? At which of the labeled sites on the image is the mutation most likely located? We'll give all of you a few moments here to let us know in the question box how many steps you believe this question will require, and then we'll read the vignette. All right, I see the responses coming in. Let's go ahead and take a look at that vignette. A mouse model of Charcot-Marie tooth disease is created for a laboratory experiment by introducing a point mutation in the gene encoding a transfer RNA, tRNA molecule. Analysis of a sample obtained from the mice reveals that the mutated tRNA binds to its respective aminoacyl tRNA synthetase, but the tRNA does not exist in the charged form. At which of the labeled sites on the image is the mutation most likely located? I'll give all of you a few moments here to start thinking about the important clues in the vignette and lead-in as I hand it off to Paris.
Thank you, Sean. So once again, we are going to go ahead and show you what we think are the important clues in this vignette and the lead-in. So this is talking about a mouse model, okay? So just important to keep in mind that these are not necessarily humans, okay? They do tell us specifically the disease that they're studying, okay? So important to make note of that. And then they kind of get to the point pretty quickly. They do a point mutation in a gene or a tRNA molecule, okay? So we're gonna have to go back on our cell biology and molecular biology and kind of think back to what they're asking, okay? So then they're asking about a mutated tRNA binding to is able to bind to the aminoacyl tRNA synthetase, but the tRNA doesn't exist in the charged form, okay? So I think we're gonna have to fall back on some of our cell bio and molecular bio knowledge, as I said about, okay? So how many steps is this question? Well, first, it's asking us about, on that image, which label site is a mutation most likely going to be located? So I think, you could argue this is a one-step question. They're telling us what the mutation is, but I think, there's another step here that we need to know, almost like the anatomy of a tRNA molecule, and know the different sites and where the mutation is going to be affecting. So I think this could actually be a two-step question here, okay? So let's take a look at the answer choices. As you can imagine, it's probably going to be, as we work our way up, E, D, C, B, and A. So make sure you take a good look at that image, okay? They're asking where on that image is a mutation most likely located, okay? So we're going to go ahead and open up that poll. Go ahead and select the answer you think is the best answer, and we'll talk about it in just a few seconds.
Excellent. Thank you, Paros. Once again, keep in mind that there is no penalty for guessing on test day. You only get points for correct answers and not penalized for incorrect ones. So even if you're unsure this evening what the correct answer is, take your best guess. Never leave a question blank, certainly not tonight. And then we will go over the correct and incorrect answer choices, something which you should be doing when you do practice questions. Sometimes students just look at the right answers and move on, but make sure you got it right for the right reasons, and make sure you understand why the incorrect answer is in fact incorrect. All right, I see responses coming in. There seems to be a clear favorite. Let's take a look and see what all of you selected. It looks like 44% of you selected B. And second place was D. So let's take a look and see what the correct answer is. And the correct answer is indeed B, and 44% of you got it right. So well done. Let me hand it off to Paros so he can explain it to us. Paros.
Thank you, Sean. Nice job, guys. So let's take a look at this question, okay? So they're saying that the mutation is most likely located in the amino acid acceptor stem of the tRNA, okay? And that's at the 3' end of the tRNA molecule. And that's where a specific amino acid covalently binds, okay? So they're saying the tRNA does not exist in the charged form, okay? But it can bind to the amino acyl tRNA synthetase. So let's take a look at the next slide. And you can see there at the bottom, well, one, in the highlighted, you can see that the D arm allows detection of the tRNA by amino acyl tRNA synthetase. Okay, so we know that's fine. They did say that the tRNA doesn't exist in the charged form. Okay, and this is where that synthetase and the binding of the charged tRNA to the codon, that's when that comes into place. And that synthetase matches an amino acid to the tRNA, okay? So let's take a look at the next slide. And Sean has gone ahead and pulled up another figure, and you can see there that the charging step is the middle step, where that amino acid is covalently bound. And you can see that it's bound to the 3' sites, okay? And that's at the end of the CCA chain, okay? So if we go back to our question, we can see there that that corresponds to site B. That is where the mutation is most likely located because this tRNA is not charged. However, it was able to bind to the synthetase, so we know that's not the issue, okay? So let's take a look at the other answer choices real quick. Site E, that is the D arm, okay? And that's necessary for the tRNA recognition by the correct amino acyl tRNA synthetase. And we know that is fine, okay? Site D, or letter D, sorry, that is the anticodon loop of the tRNA, and that pairs with the specific codon on the mRNA. Site C, that is the variable arm of the tRNA, okay? That helps stabilize the tRNA, and that assists the synthetases in recognizing the correct tRNA. And lastly, site A, that is the phosphorylated 5' end of the tRNA. Doesn't really have a role in this question per se, So not the best answer choice there. So nice job on this question as well.
Excellent. Great job, everyone. That was a challenging question and probably something a lot of you haven't seen in quite some time. So well done, everyone. You know, we mentioned RX Coach earlier, and I want to take a moment here to tell you about it. You know, recently we had a really amazing story with one of our students actually breaking a 260 on step 1, and will now be joining us as one of our RX coaches. So what do we do at RX Coach? Well, whether you're studying for exams while you're in medical school, whether you're studying for subject-based shelf exams, whether you're studying for the comp, USMLE, the COMLEX, step 1 or step 2, we're here to help. What we'll do is we'll analyze your strengths and weaknesses, and we can do that via an assessment if you're studying for your board exams. And once you take that, we'll create a personalized study plan. And then we'll work with you to implement that study plan, to identify your strengths and weaknesses, to work on your test taking skills, to work on timing, to work on stamina. And we hear from students all the time that, you know, they've been studying, but they're plateauing or not making as much progress they want within a given amount of time. When students come to us, they tend to tell us that they're seeing progress much more rapidly because our certified RX coaches are experts. They know what they're doing, and they have so much experience doing this that we're able to give you an effective study plan that will save you time and get you to where you want to be more efficiently. So if you're interested in working with our coaches like Boris or Brian or one of our other wonderful coaches, please reach out to us at rx-coach or rx-coach.com. You can click on the free consultation tab to set up a consultation with us to talk about the program and how it can benefit you. Anytime you're debating about, you know, what should you do for the step, people always ask, which tutoring company should I go with, or should I take a USMLE review course? Remember this, you know, everybody's different, but if you want to take a USMLE review course, keep in mind that you will be doing the same thing everybody else is doing and expected to learn at the same pace. It's very easy to fall behind, and the individuality of you kind of goes out the window. It's very hard to focus on the individual when everybody's doing the same thing at the same time and not really focusing on your strengths or weaknesses or helping you master those test taking skills. When it comes to which company you want to select for tutoring, there's several great ones out there. We have a lot of experience. We're the only company out there that has our own assessments, that's been in the business for over 30 years educating medical students. So we encourage you that if you are interested in working with the coach, reach out to us, talk to us, and see if we're a good fit. We're happy to have that conversation and help you in any way we can. So with that, let's go ahead and move on to our third question of the evening. Keep in mind that we have 2 questions left, and at the end, we do have a raffle and a special offer. So make sure you stick around because you must be present to win. Once again, the answer choices are covered up, and we will begin with the lead-in. Which of the following additional effects is most likely in this rat? Which of the following additional effects is most likely in this rat? I'll give all of you a few moments here to let us know in the question box how many steps you think this question will require, and then we will move on to the lead-in. All right, I see some responses coming in. Let's go ahead and take a look at that vignette. A researcher is investigating a new drug. In the experiment, rats are injected with the drug, which augments hepatic production of a protein. As a result, the researcher observes increased chondrogenesis at epiphyseal plates and decreased growth hormone releasing hormone and growth hormone secretion. Which of the following additional effects is most likely in this rat? We'll give you a few seconds here to start thinking about the important clues in the vignette and lead-in. Hand it off to Paris. Paris.
Thank you, Sean. So once again, we're going to show you what we think are the important clues in this vignette and the lead-in. And as you can see here, we have another experimental question. You are going to get these on step 1. So we know it's an experiment about a new drug. Okay, again, we have rats here, not humans, and they are injected with this new drug. We are told something specific about what this drug does, and then we are told the effects. So the cause and the effects, okay? All important to make note of because we're going to have to use those effects to figure out what is going on. What is this drug, okay? So I think we have a couple steps here. This question is asking us specifically about an additional effect that is most likely to be seen, okay? So I think one, we need to figure out what are they being injected with? What is that new drug based on the effects? Two, what else could we see from the answer choices? So I think we have a nice two-step question here. So let's go ahead and take a look once again at those answer choices. And again, we have 5 answer choices. And again, we're going to start at the bottom and we're going to work our way up to the top. Answer choice E, increased protein catabolism. D, enhanced insulin sensitivity. C, decreased lipid oxidation. B, decreased hormone-sensitive lipase activity. And A, decreased glucose tolerance. So we're going to go ahead and open up that poll. Go ahead and select what you think is an additional effect that's most likely to be seen. And we'll talk about it in just a few seconds.
Thank you, Paras. So this is our third question of the evening. We've opened up the poll. We'll wait until about 2/3 of you have responded before we move on to our last question of the evening. For those of you wondering what next week's topic is going to be MSK. I see the responses coming in. We'll give all of you a few more moments here. All right. Keep in mind that we do have a raffle and a special offer. So make sure you stick around until the end because you must be present to win. All right. Let's take a look and see what all of you selected. Looks like the favorite here with 37% was enhanced insulin sensitivity, and in second place was decreased hormone-sensitive lipase activity. Let's take a look at the correct answer, and the correct answer is indeed D. 37% of you got it right, so well done. This was a hard question. Let me hand it off to Paras so you can explain it to us. Paras.
Thank you, Sean. So nice job. Another tough question here. You guys are doing well today. So let's take a look at this answer, this correct answer choice. So they told us that this investigational drug increases the hepatic production of a protein, okay? They say that it increases chondrogenesis at the epiphyseal plates and decreases secretion of growth hormone and growth hormone releasing hormone. So hopefully if you take those clues all together, you are able to figure out that this is insulin-like growth factor, or IGF-1, okay? IGF-1 stimulates the growth of skeletal muscle, bone, other tissues, including cartilage, as you can see here, increased chondrogenesis, okay? It feeds back on the hypothalamus to reduce growth hormone releasing hormone secretion, and then also on the anterior pituitary to decrease growth hormone secretion. So step number 1 is figuring out that this is IGF-1 that's at play here, okay? So then it's asking us what else is an additional effect that we could see, okay? IGF-1 does bind to the insulin receptor, and it actually enhances insulin sensitivity, okay? So you have more glucose uptake and you have less hepatic gluconeogenesis. It's actually kind of opposite of growth hormone, which decreases insulin sensitivity. So IGF-1 and growth hormone normally have pretty parallel or similar effects, except when it comes to insulin sensitivity. That's where they kind of differ, okay? So hopefully you guys understand why that's correct, but let's talk about the other answer choices and why those would be incorrect. Increased protein catabolism, that would be a potential effect of glucagon or cortisol, not what we're talking about here. Decreased lipid oxidation, that would be an effect of growth hormone, which again, is something to think about here, but as we talked about, actually causes decreased insulin resistance or increases insulin resistance. Answer choice B, decreased hormone-sensitive lipase activity. That's an effect of insulin. That's not what's being produced here, that hepatic production. And then lastly, answer choice A, decreased glucose tolerance. That's a result of decreased insulin sensitivity, which could also be caused by growth hormone as well as other things. So also kind of opposite of, as we mentioned. So the best answer choice here would be D.
Excellent. Thank you, Paras. Great job, everyone. Let's try to finish strong now with our last question of the evening. Once again, the answer choices are covered up, and we will begin with the lead-in. Excess of which of the following acids characterizes the most likely diagnosis in this patient? Excess of which of the following acids characterizes the most likely diagnosis in this patient? Once again, I'll give all of you a few moments here to let us know in the question box how many steps you believe this question will require, and then we will move on to the vignette. Move on to the vignette, yes. All right, I see the responses coming in. Let's go ahead and take a look. An 89-year-old man is brought to the emergency department from a nursing home with a 2-hour history of severe abdominal pain and bloody stool. He has a history of type 2 diabetes mellitus, myocardial infarction, hypertension, dyslipidemia, and atrial fibrillation. His pulse is 120 per minute, and blood pressure is 90/59. Physical examination reveals upper left quadrant abdominal tenderness, guarding, and rigidity. The urine analysis is negative for blood, protein, and glucose. An arterial blood gas shows pH of 7.3, bicarb of 12, PCO2 of 25, and PO2 of 82. Excess of which of the following characterizes the most likely diagnosis in this patient? Paras.
Thank you, Sean. So once again, we are going to go ahead and show you what we think are the important clues in this vignette and the lead-in. Okay, so we've done this 4 times now, so hopefully you guys are starting to get a sense of, you know, what's important to highlight in a question, and maybe what's not as important to highlight, so that when you go back and take a look over that vignette and the lead-in, you know, you've really highlighted only what you need to highlight. You can save time as well, okay? So let's go ahead and do that one more time with this question. Again, demographics. So now we've kind of flipped the script and are working with an older man here, okay? They give us some important past medical history, okay? And then they give us some vital signs, some physical exam signs, all of which are going to be important in this question, okay? They also told us exactly why he's coming in: severe abdominal pain and bloody stool. So that's what brought him to the ER. It's always important to make note of why did they actually come to the hospital? Why did they see the physician? And then how long has that been going on for? It's been going on for 2 hours, okay? They then give us an ABG, or arterial blood gas. Always important to know how to look at that and how to decipher that, okay? Then they're asking us excess of which acid characterizes the most likely diagnosis, okay? So I think we've got a few steps going on here. I think one, we need to figure out what is the most likely diagnosis, and then 2, what acid would be in excess in that diagnosis. So I think we have a nice 2-step question here. So let's take a look at the answer choices one more time. And again, we are going to start at the bottom and we're going to work our way up to the top. Answer choice E, L-lactic acid. D, formic acid. C, D-lactic acid. B, acetoacetic acid. And A, beta-hydroxybutyric acid. So we're going to go ahead and open up that poll. Go ahead and select what you think is the best answer here, and we'll talk about it in just a few seconds.
Excellent. Thank you, Paras. So let's try to finish strong here with our last question of the evening. We'll give all of you a few moments here before we hand it off to Paris for an explanation, and of course, later to Jeff for a raffle and special offer. I see the responses coming in. We'll give all of you a few more moments here. Keep in mind that next week's topic is going to be MSK. All right, so responses coming in. Just a few more seconds here. All right, well, let's take a look and see what all of you selected. 30% of you selected C, D-lactic acid, and 27% of you selected L-lactic acid, and 26% of you selected beta-hydroxybutyric acid. So very, very close between first, second, and third place. So let's take a look and see what the correct answer is, and the correct answer is E, L-lactic acid, and 27% of you got it right. Let me hand it off to Paris so we can explain why. Paris.
Thank you, Sean. Yes, definitely a tough question here. So let's take a look at this question again, okay? So in terms of the clinical setting, there's a couple things here. We have a clinical picture and then we have more of a biochemical picture. So clinically, this patient is having acute mesenteric ischemia, okay? Severe abdominal pain with guarding and rigidity, okay? Blood in the stool as well. Why does this patient have acute mesenteric ischemia? Well, as you can see there, this patient doesn't really have a good past medical history. Diabetic, hypertensive, high cholesterol, MI, and even atrial fibrillation. Okay, so a lot of reasons to be having acute mesenteric ischemia, okay? In acute mesenteric ischemia, you can see there that the patient starts to become can start to become acidotic, and that ABG is consistent with that. We have a pH of 7.3, we have a bicarb of 12, and we have a low PCO2. So this is likely a metabolic acidosis with a little bit of respiratory compensation, okay? So in this setting, this patient's metabolic acidosis is likely due to lactic acid production, and that increases, as we know, under anaerobic conditions. And in this setting, in a low PO2, in a setting of ischemia, we know there's not going to be really good aerobic conditions. It's going to be more of anaerobic conditions, okay? In anaerobic conditions like ischemia, pyruvate is converted to lactic acid by lactate dehydrogenase. So we know lactic acid is going to increase, okay? So then the question becomes, well, now we know maybe it's lactic acid, but is it L-lactic acid or is it D-lactic acid? It's actually L-lactic acid. L-lactic acid is the common compound of human metabolism, okay? So when we're thinking of what is a human producing, it's usually L-lactic acid. D-lactic acid or lactate is produced normally by bacteria, okay? So some of the bacteria in our intestines can produce D-lactic acid. So some of the situations where you might have elevated D-lactic acid are patients who have short bowel syndrome or any other condition that causes overgrowth of the bacteria in the intestines, okay? But in the human, otherwise, human lactic acidosis is generally L-lactic acid, okay? Let's take a look at the other answer choices, make sure we understand why those are incorrect. Formic acid, that's increased in patients who have ingested methanol, okay? Nothing here about ingesting methanol. And lastly, answer choice B and A, that has to do with diabetic ketoacidosis, which is not what's going on here. We know this patient does have metabolic acidosis, but as you can tell there, wouldn't explain some of the other signs and symptoms, so not as good of an explanation for what's going on. Hopefully you guys were able to pick up a few things from today's session, and great job overall, and I'll hand it back to you, Sean.